We have just opened up a couple other health centers for vaccines just to the general public. So currently we have let me just pull this up here. Center for Family Health in Sycamore, Lake Health Center in Hanover Park, McKenna Community Health Center in McHenry, Creekside Health Center in Wheeling, as well as our Streamwood Community Health Center in Streamwood, open for the general public that fall under Phase 1A and 1B, including Part 2. So it is by appointment only, and we are only scheduling appointments up to 2 days into the future, and it of course depends on the availability. We also do have one health center that is reserved only for existing patients. So anybody who is a current patient of our health center can make an appointment for at Summit Health Center. That's in Elgin. Again, it is dependent on the availability. Currently, we're offering the Moderna vaccine. I know that's something that sometimes it's a question that is asked. And we are also providing testing as well. We continue to provide those services, again, by appointment only. And we're also doing some vaccine clinics out in the community this month. We've been kind of partnering up with some community organizations, police departments, as well as local churches. Recently, we've been partnering up with the Second Baptist Church in Elgin, as well as the Housing Authority in Elgin. So, yeah.
Great. That's awesome. Any idea, Lorena, on how many in Elgin, at least, have been vaccinated?
I don't have any specific numbers for Elgin.
I'm assuming it's low at this point because it's just kind of sort of started.
Yeah, it just depends on the supply that we receive from the counties. One thing I did want to mention too is that we are following the Idph guidelines. So we are, like I mentioned, doing 1A and 1B and Part 2. And I know some counties are restricting it to like seniors only and things like that, but we are following Idph guidelines. So
okay,
it just depends. Mm-hmm.
Does IDHP have any idea, like when the general public, when this thing will just finally be kind of open? Any projections for either Elgin or our county?
I don't know. I think that would probably be a better question for maybe the health departments or yeah.
Thank you. Appreciate that.
Mm-hmm.
All right. Anybody else? Anything coming up? Any events? Any announcements you want to make? Any interesting movies you've seen? Oh, I see Jim's joining us. By the way, before Jim gets started, so Netflix has this show called The Pharmacist. If anybody has seen it or hasn't seen it, give it a gander. It's a series, and it's about, it's a gripping drama, frankly, of a gentleman that lost his son due to a drug deal gone bad, but it all revolves around Oxycontin many years ago. So take a look at it. It's quite emotionally moving as well. So anyhow, I see Jim has joined us. Jim, thank you so much for joining us. We're all kind of ready for your presentation. Our president has yet to join us, but our treasurer did join us. Thank you. Tina's here. And so when Jim, when you're done with your presentation, Tina, if you don't mind, if Jack's not around yet, I'll give it to you to lead on to the next agenda item. All right. Jim, you're on. Thank you so much.
All right, thanks. Hi, everybody. My name is Jim Brunetti. I'm the clinical director here at the REN's office, and we've merged with Ecker Center for Behavioral Health. We do the substance use stuff over at our office, and we're a department in a really large organization that is a community-based nonprofit that works with mental health and substance use. So here at the REN's office, we work with substance use disorders, and we, in our clinical department, work with adolescents and adults. And that's just one small department here at the REN's office. We also have prevention services, ATOD, alcohol, tobacco, and other drugs. We have HIV services, access to justice, CSHE. So we have lots of different departments that work with prevention, with stopping people and giving them information to educate them so then they don't start using drugs. And then if someone gets into trouble and they start using drugs and they need help, they could come to our outpatient services. And we also have medication-assisted treatment. Suboxone is a drug that is used for opioid use disorder. And I heard Gil talking about the opioid crisis and how big of a problem it is. And there's also another really good movie called Beautiful Boy that Steve Carell is in, and it shows how devastating opioid use could be. And it really paints the picture really well if you want to see like the destruction and how it just unravels somebody's life. So yeah, there's lots of good movies and you know, information out there to get a little more background and to paint the picture. So here with our outpatient department, we screen all of the clients that come in who are using drugs and alcohol. We have Quest Diagnostics, which is a laboratory that's well known. So anyone who comes into treatment here is given a toxicology exam. And then after they provide urine, it's sent out to the lab, and we could detect if somebody is using drugs and alcohol. Depending on how much they're using, it could go back to about a month. You know, we could see how much they're using and how far back they were using. And we're able to detect that. So once we detect the drug and alcohol that a client is using, that's how we formulate a diagnosis. And then off the diagnosis, there's a treatment plan that's developed, much like handling someone who has a chronic disease. You know, if you go to a doctor, it's the same type of care that you get here. There's Quest Diagnostics and the medical screening with toxicology. There's a medical review. And then there's a treatment plan that is a guide for the client in services, in which we have the problem areas. And then also we have time to measurable goals in which the client can reach sobriety, but sometimes it takes multiple attempts and time for them to do that. The more severe people that come in here who are using are placed into our intensive outpatient program. And it's called IOP, if you've ever heard that term. And if you have not, I'll explain it to you. IOP is for people who are more severe. They might be stepping down from residential or from a hospital, or they might just be like, you know, right one step away. So this is like their last attempt at outpatient before they are placed into a hospital. In the intensive outpatient program, the client will come here 4 nights per week for group, and they will be in the IOP group, which is a lot like going to a class. And what that means is if somebody is using drugs and alcohol, they are isolating, they are no longer working, they are no longer getting along with people, so their personal relationships aren't doing really well. So IOP works on all the different areas of somebody's life and giving them guidance and getting them back to living a productive life. So it might be focusing on your job, or focusing on your relationships, or, you know, focusing on the triggers that make you want to use. These are all topics that are covered in the group. And another topic might be how to regulate your emotions. And there's something called DBT, which helps with emotional regulation, and just being able to kind of hone it in and be in the moment and not get too far ahead of yourself, and to you know, not get overwhelmed. And overwhelmed emotions could lead to somebody using. So it just kind of helps somebody regulate their emotions and find the right coping skills in the moment. We also have a gambling use disorder program. We have a certified gambling counselor who went through a program funded by the state and has a certification to do counseling specifically for gambling. Gambling is everywhere. You could gamble from your phone. If you're watching a football game, there's commercials advertising gambling, and they make it look really fun. You know, now you could go to the casino. Well, the casino's closed because of COVID. Don't worry, you could gamble on your phone. And it's really targeted towards the 18 to 35 age demographic, and it makes it look like it's fun, exciting, easily accessible. But we are seeing more people becoming addicted and dependent on gambling and entering our program. So someone could be dependent or addicted to many different things. With substance use, with like opioids and alcohol, someone becomes physically dependent. With opioids, someone can't stop using, and if they do, they become sick. They have what's known as withdrawal or dope sickness within the using community. And that means that your body becomes so dependent, once you stop using the drug, the body can't function without the drug, you know, signaling the brain to not feel sick. It works off your receptors in your brain. With gambling, there is no drug that somebody's physically dependent on. With gambling, it's a dopamine release. So your brain when you feel pleasure or you're happy or excited, produces dopamine, which makes you feel good. You can produce dopamine naturally by like going for a run, or waking up on your birthday morning and everyone wishing you a happy birthday. So something external that makes you feel pleasure and happy. And gambling is something that it's also about the thrill of what could happen. So part of the dependency and the addiction comes from the preparation and placing the bet. That's part of the excitement and the dopamine release that is with that's related to gambling. Where again, with like substances, drugs and alcohol, it's more taking a pill, in smoking cannabis or eating cannabis, and that produces a physical effect. So those are the two differences. We have different programs here. We have one that's specifically for women. It's called the Passage Program, and it's a group where it's women only. We also have a men's recovery group, which is only for men. Our medication-assisted treatment program is here at 2 American Way, and we also have our psychiatric services over at the Grandstand location, over on the other side of Elgin, where Gil is located right now. We do overdose prevention training. Daryl Stewart, who's in prevention, drives with the police department, and he'll go to people's homes and supply them with Narcan, give them a box, and trains them. And then with Narcan, oh, I have some right here. This is Narcan. If someone were overdosing on opioids and they're starting to lose consciousness and their breathing is slowing down, they're slowly fading away, they could be given 2 squirts of Narcan in their nose, and that would revive them. It reverses the overdose. So instead of somebody kind of fading away and becoming unconscious and then slowly possibly dying, 2 sprays of Narcan could revive them. And that's something that Daryl does for the prevention program in the Wren's office. He drives around the police department, goes to homes, and trains people on Narcan. We have peer recovery support programs. We have a group called Smart Recovery, which is an open group. Right now we're doing it over the phone. And it's a open meeting that someone could come to, much like AA. And what AA and Smart Recovery, what they do is it's an open meeting. Somebody comes and they could either come and listen, or they could talk about what they're struggling with, what drug, alcohol, or it could be gambling, it could be anything that they feel dependent on, smoking cigarettes. They could process that with other people who are going through the same thing and get support that way, which is a really nice program. We do DUI services here. So if somebody gets a DUI, which means they're pulled over from the police and they were given a breathalyzer and they were over the legal limit, then the Secretary of State will require that that individual needs to go to get counseling and do a DUI evaluation. So we do the official DUI evaluation for the Secretary of State here at the Wren's office. And we then relay that information to the state. And based on what is determined from the evaluation, that person will have to do a certain amount of treatment in order for them to get their license back. But that is something that we do here as well. And that's kind of like what we do. Does that kind of sum it up for you, Gil?
Gotta mute myself. Sorry about that.
Yeah.
It summarizes fine for me. I know you're going to have a Q&A.
Sure.
So as people kind of gear up for that, I do want to thank you for sharing with us the information.
Sure.
Admittedly, even me who works here and there's so many, ECHR can be so big sometimes, and I can get so focused on the coalition. Not even sure everything that they do. So thank you. I learned some things right now. You mentioned Narcan. One of the things, as you know, obviously the coalition's focus is middle and high school students. Is Narcan something that can be given to them, or is there a point where you can be too young to receive it?
Well, anyone who's overdosing can be given Narcan. So what can happen, a case scenario could be like, let's say Johnny gets a hold of somebody's pills in the house and starts taking the pills, and now Johnny is overdosing. Narcan can be given to Johnny to revive him. So if Johnny weren't overdosing and he was given Narcan, it's non-toxic, so there would be no like negative effect. He would be fine. But anyone who's overdosing, Narcan attaches to the same receptor, the part of the brain. Okay, receptor will tell someone, will tell the body, the brain signals the body that it's time to start, like the breathing will slow down, and you're becoming unconscious, and the lungs will not work as well, and you're slowly losing consciousness. These are all signals that the brain will send you. So Narcan attaches to that receptor that's telling the body to shut down and stop it from signaling to the body to shut down. So it revives the person and brings them back. Awesome. So is it magic? No, it's not. Does it work all the time? Probably not. It depends on how much the person has used on that day and how far along they are with the overdose. If somebody's like been overdosing for an hour and they've used lots of pills and they're given 2 squirts of Narcan, it may or may not work. But if it's caught early, if it's someone's like 5 minutes into an overdose and they didn't use that much, then the chances are pretty good that it will revive somebody. Also, it depends on what's the physical state of that person. If somebody is healthy, they'll be able to bounce back and revive themselves after receiving a few squirts. If someone has multiple health problems and they're given Narcan and their body just can't, bring itself back, then it might not work. So it's kind of like, I can relate it to doing CPR. You're trying to give someone a chance to live and to become revived, but it's not 100%, but it's pretty good. It's going to give that person a fighting chance. Does that answer your question?
Absolutely. Thank you. I appreciate it.
Yeah. Any other questions? I'm more than happy to answer anyone's question.
This is Kathy. I have a question. What was the drug that you were talking about that helped your customers focus?
That helps people focus?
Yeah, you said that there's a drug that you give them. I assume it's sometime down the path of their recovery, or maybe it's early on. I don't know.
Oh, okay. Well, the drug to help somebody focus is not an addiction medicine. There's like Adderall, which could help somebody focus with like ADHD. That is separate than an addiction medicine, but Adderall does help people focus. As far as helping somebody feel normal and reversing the withdrawal symptoms, there is a drug called Suboxone. And
right.
So let me explain Suboxone. Suboxone is used for someone who's struggling with opioids and opioid use disorder. If someone becomes dependent on, let's say, heroin, they cannot stop using heroin without feeling sick. So if they stop using, they could have like flu-like symptoms for, it could be a few days, it could be a few months. Some people have even had it for a year. So they might not be able to think, they might not be able to function, they might not be able to go to work. Everyone's telling them to stop doing drugs, and they stop doing drugs and they can't function. So what do you think they do? They go back to using drugs. And they use just enough so they could get up in the morning and be functional. But if you're using drugs to be functional, if you're buying street drugs, that means you're buying fentanyl and you don't know the amount that's in there. So if somebody has that approach and mentality, what happens is they might use a little bit and overdose because they don't know how much is put in the bag of heroin that they buy. Drug dealers don't work for the FDA. There's no regulated amount. You don't know what they put in there. So a more healthy and safe route to go when somebody is trying to stop is to use Suboxone. Suboxone is a drug that's approved by the FDA. It is prescribed by a medical doctor, which we have on staff. A very small dose of Suboxone attaches to that same receptor. And what it does is it stops the patient from craving drugs and from using drugs. They feel normal again. From that first dose, they perk up. And over time, they get their life back in a safe way that's regulated by a medical staff, and they have counseling. And it's just, it's a lifesaver is what it is. So the drug is called Suboxone. Suboxone is used for opioid use disorder. Opioids could be heroin, opioids could be fentanyl, opioids could be Norco or Oxycontin. So if somebody is dependent on that, there is a medicine where a small dose could help somebody stop. And it's not a lifetime type of deal that you're making where you have to take the drug for the rest of your life. You just have to take it long enough until, you know, the client feels like they could stop using or reduce the medicine to where they could, you know, function on their own without wanting to use more drugs. So that's one of our drugs. And quickly, Vivitrol is an injection that is given, and it's given every 3.5 to 4 weeks. And it helps stop cravings for alcohol and also for opioids. And if somebody were to use alcohol or opioids, Vivitrol would block the user from feeling any sensation or effects from it. The same thing with Suboxone. There's an ingredient called naloxone, which is the same ingredient in Narcan, which if somebody takes Suboxone, which is good, Suboxone is a legally prescribed drug. If they were to inject heroin, they would feel nothing because naloxone blocks the effect of the drug.
Thank you.
Oh, you're welcome. Does that answer your question?
Well, yes, and I'm a nurse, and I was a jail nurse, so I realized that some of those things happen. But early on in your presentation, I thought you used a three-letter like acronym for something that I thought perhaps I misunderstood, that they took to focus, a drug that you prescribed to help them focus. And I just wondered what that particular drug was.
Yeah, so MAT is medication assisted treatment. It's an acronym for.
Okay.
Yeah. So it's a term that's used in the substance use field. MAT is medication assisted treatment. Yeah. So Adderall helps people focus who are struggling with that.
Right. Thank you.
Yeah, sure.
Just want to keep us on time. I know we're kind of getting to the next part of the agenda. I don't want to cut off any good conversations, but does anybody else have any questions for Jim before we move on?
I'll use my real hand. Jim, I just want to say thank you for coming. I know I introduced myself via email, and so just really, I learned a lot from your presentation. I think there's a lot of information I can take back to the Boys and Girls Club, and I know your schedule is tight today, so I really appreciate you making some time for us. So thank you very much.
Yeah, no problem. And I got to get back to another meeting, but let me give you a phone number really quick. If somebody needs either mental health or substance use services, they could call the main Ecker Center for Behavioral Health line. Phone number is 847-695-0484. 847-695-0484. Yeah, so if you're in doubt, it's still okay to call, do an assessment, run it by a professional and make sure that there is no problem. Or if there's somebody that you would like to refer, call that number. We also work very closely with probation, Kane County probation, and various probation departments, you know, across this area. So we coordinate care and send out reports, and we work with families. So very thorough program on both the mental health and substance use side.
Thank you so much, Jim. Really appreciate it.
Yep, you got it.
Jim.
Okay.
Awesome.
All right. Everyone have a good day.
You too.
Thank you. You too.
Thank you.
So I'll jump into the next part of the agenda. Sorry, I was late as well. I'm here at the hospital, so I'm never know what's going to happen. I do want to say on behalf of everybody on the coalition and the executive committee, thank you, Carrie, for securing that presentation today from Jim. That was awesome. And thank you for getting other folks lined up down the road. I really appreciate that. And so just wanted to extend that thank you to you. As far as the executive committee, I don't know if Jack is on. I'm on two different screens here. So
he is not that I can see.
Okay. So I don't really have too much of an update. Gil, is there anything that we want to add? I know I was, like I said, I was kind of late, so I'm sorry, but anything we want to add from the executive side?
I think the biggest thing that we kind of discussed, and this affects everybody that's here now and other members that aren't here. And that is that what we want to try to do is the things that we've been talking about in the executive committee, we'd like to move more and more of them to this meeting so that you guys get a sense of what we're trying to do and get more buy-in and really it becomes more of your coalition. Part of the problem we're facing, one of the challenges, of course, is we have a very small executive committee. There's only 3. And that's okay, it works in some places, but frankly, given that 2 out of the 3 are involved in the healthcare industry, and given that COVID-19 and its subsequent vaccinations are really taking a lion's share of everyone's time, it gets difficult sometimes just to even get together. So one of the things that we'd like to do is just to bring up some of those more administrative, logistical things to you guys to get your input and your thoughts, et cetera, et cetera. So just be aware that we'll probably be adding a few more things there just to get you more involved and, get you to more of the feeling like you're definitely part of the coalition because you are. We're very critical. And that's really the lion's share. We do have the minutes or the notes should be in your consent agenda so you can see what we actually talked about. But that's I think the main thing to get out of the executive committee meeting.
Yeah, thank you, Gil. Appreciate that.
You're welcome.
If anybody's against that, let us know. But I don't think we're gonna have a problem.
Yeah. Well,
So
Bernie and Matt talked to him.
Yeah, right. All right. So we'll move down. I've got drug-free communities from Gil.
All right. Thank you, guys. I appreciate that. All right. So here's my March report. It's very brief. I want to keep it brief. And that's partly because we've had a lot of activity. We're just starting to kind of regain traction again now that stuff's over. But one of the questions that I wanted to ask all you guys and get your input on is with the opening up and the relaxing of the COVID-19 restrictions for public gatherings, et cetera, we'd like to begin to connect again with some of the youth. And I wanted to get your guys' thoughts on that. Are we ready to start doing more in-person stuff for the kids? Obviously, everything's got to be within the guidelines and requirements of both local and state authorities. But any thoughts on that? Anybody have any 2 cents that they want to give me?
I have a thought. Can you hear me, Gil?
Yeah, we can hear you.
Yep.
Go for it, Christina.
So I think we're ready. I think the youth are ready. I know from, my daughter, so they're right now, I think they need these events or at least activities that they can do with other teens because they're suffering too with their mental health and they need an outlet. So small groups, but I do think that they need something. So
awesome. Thank you, Christina.
Mm-hmm.
Anybody else? Any thoughts? Good idea, bad idea? Not sure.
I was just thinking it would be good to have some of those events, maybe more of them, but smaller in size. So I know, like, I'm thinking of the ones that we did before that were like, overcrowded to the pack where we had a line outside forever, obviously within the guidelines, but maybe have more opportunities for them to do things so we could get different kids in and rotate it a little bit because I know the suicide rate is really high right now for youth and it's a big struggle for them being isolated this long.
Yeah, thank you. Thank you, Jenny. I appreciate that. Anyone else going to give you their 2 cents, piece of their mind, if you will?
Well, just a suggestion, Gil. I really liked when you did the group of with the photography project that you guys did. So yeah. Something like that would work really well right now because it's a small group.
Yeah, that's a great idea. That's right. It was like 9 kids and that worked out really great. Okay, great. And they all worked independently. So there wasn't really any like joint together, but even if we had to fit 9 kids in a room is easy and still maintain social distancing. So thank you. That's a great idea. I appreciate that. All right, great. Well, barring any violent objections, I'll move on. But in case, if you do, and you didn't want to express them necessarily, feel free to reach out to me. Not a problem. The National Coalition Academy. So I need somebody to be my partner. This is for 3 weeks. I have somebody that's going to be with me week 1. I have somebody that's going to be with me week 2, but I need somebody that's going to be with me week 3, which is in September. And it's like Monday through Thursday. and it's the opportunity to really learn the nuts and bolts of coalition work. And they want someone like me, the director, and then they want a coalition member to show up. I did it all by myself a few years ago, and that was painful. So all I need is one more person that would be interested. You don't have to commit now, but if you tell me you're least interested and you want to talk more about it, let me know. Anybody? Who is it? Who's going to be my partner?
Gail, if you need someone, let me know. I'm willing to help.
Okay, thank you, Jenny. I appreciate that. I'll let you get all the details. And again, you're not committing yourself, but I'll let you know and we can talk. And if so, that would be awesome. Thank you. I appreciate it. The CATCA is over, as you guys already know. We gave you guys a little bit of a brief rundown, but since our last meeting, they did publish like a 3-minute video on the recap for this year. This is their annual forum that they typically had in Wisconsin, or in Washington, D.C. So I'd like to play that for you guys just to get an idea of what that CATCA forum is. This is our Mecca. This is the main event, the main place that coalitions across America go to every year. This is their conference. They have a smaller one mid-year, but this is the main one in February. So let me play this and then see how it goes.
Play your guitar.
On behalf of our organization, I would like to welcome you to the platform for our 31st Annual National Leadership Forum.
So one more time, congratulations, NCA graduation class of 2021.
CATCA has really done a great job of delivering training and technical assistance out to local coalitions.
That's what the CATCA meeting is about, is sharing ideas, meeting people, and really promoting prevention in communities. Yeah.
I've done many a power session. You can't tell, but I'm smiling broadly because it's always good to be back with our CATCA partners.
Prevention is so important. It's one of the reasons why I've been a big believer in myself going out to schools, getting into schools early.
And if you can't see, that's the man for you. Oh, well, do what you do and get around.
So many years that we have been active with the Community Anti-Drug Coalitions of America. I first became involved at the end of the 1980s and formed one of the anti-drug coalitions.
Your dedication to keeping your community safe, healthy, and drug-free, even in the midst of staggering challenges, has made this a groundbreaking forum experience.
We need to maintain our standing and our role in the community as being good citizens. We need to interact, and we need to make sure that we do what we can in this space. And prevention and treatment is a huge piece of that.
We've been collaborating with CATCA to deliver evidence-based content, and we will continue to do so, and there are already projects underway.
It's the combination of that innate biology with the environment that's essential in leading to exposure to substances and eventually to addiction itself.
I met my closest friends, worked alongside the most inspirational people I'll ever encounter, and especially as a CATCA youth trainer, I've had the privilege of meeting those of you just like myself, young leaders who love what we do.
Ladies and gentlemen, it gives me great pleasure to announce our National Leadership Award winner, Major General Arthur T. Dean.
Thank you for your many years of love and support, and I wish General Price and the whole team at CATCA and all of you nothing but the greatest success as you move forward in this very demanding environment. God bless you. Thank you.
General Dean, you're not just the head of CATCA, but you've been a recognized leader of this movement in our nation. And you're a tour de force, on the global stage within the United Nations. And so I thank you for your vision, employee number 9. One CATCA doesn't necessarily mean this is all CATCA focus, but it's about the movement, that there should be one voice and one focus in our movement. Remember, we need to become one CATCA. I thank you for what you're doing every day. I thank you for the phenomenal work that you're doing during this pandemic. I thank you for the lives, scores of lives that you're saving. every day as we build safe, healthy, and drug-free communities globally. Thank you.
And of course, thank you guys as well. So their mid-year's coming up, and we've traditionally, this has been all over, it takes place usually in different cities around the country. Again, they're going to do it virtual this year as they did last summer, and maybe things will be different in 2022. But for right now, we're willing to, we've had a budget for travel, airfare, transportation, per diems. But given that it's all virtual this year, we can afford to send a couple extra people, more than normal, to attend. So if you're interested in attending their mid-year, please let me know. I think the training is incredible. And the mid-year tends to be more in focus and more in depth, as opposed to their February forum, which is their main event. This one is definitely going to get you some good stuff. So if you're interested, anybody interested, like right now, they know they'd like to be part of CACA mid-year, let me know.
Can you share this information to us via emails just so I can forward it?
Yeah, absolutely.
Okay.
Absolutely.
Perfect.
And we pay for everything. All we need, obviously, is just your commitment, your time for it. But
yeah,
absolutely, I will, Lorraine. Thank you.
Because I know Claire used to participate in this, but now she has a conflict, but she may be interested in this. So I can let her know. Yeah.
Perfect. Perfect. Thank you. All right. Next. There we go. Oh, there is no next. That's the end. Thanks, guys. I appreciate it.
All right. Thanks, Gil. I think it's now, is it Bernie that's up now?
Yes.
Can I have like 30 seconds? You caught me with a mouthful of food. I'm multitasking. Okay, sorry about that. Sure. So, drug unit update. The drug unit actually is looking pretty good now. We're back doing buys. We're buying dope. We're buying guns. We have a commitment to restaff ourselves. I threw out a number that I think I might have been irresponsible in saying, that we were down or going to be down 18 bodies in the total police department. We have staffed 100% of our vacancies, and the chief went ahead and hired 2 more. She planned on hiring 2 more, but we had 2 retirements since then. So we have exactly the amount of spots that we should have in the police department. However, we just hired 8 and they're not trained yet. We just had 3 come out of the academy and they're in training now. They're not on their own. We have 2 on admin leave. So numbers wise, as far as people actually working, not including injured people, which there is at least 1 of them, we're down like 13 or 14 places. So those bodies have been hired. It's just, getting them trained with, I think the last academy took close to a year to get through, and it should take 3 months. It was at least 9 months. It kept shutting down because of COVID. So we have provided a trainer for this next academy. We have 8 people that we've hired, 7 of which are going to the academy. The drug unit, there's talk around here of things that are happening, like maybe merging resources and doing stuff to get us assistance, especially since we're now back up and running, doing buys and stuff like that. There's a lot of work to be done. I think everyone got, I don't know if they read, the actual, what the city council thinks about cannabis and having dispensaries and that. There's a lot of laws that are being shoved down and I say shoved down, I guess the people we voted for created these laws. So maybe I'm using bad words, but when it comes to legalizing cannabis, it's not going to make the coalition's job of prevention any easier. It's going to make it harder because it makes access easier. A city council person has to look, if they're going to open a dispensary on Randall Road in South Elgin, Carpentersville, or Elgin, does it really matter as far as accessibility, as opposed to can we gain revenue from it? There's things that they're trying to do with the revenue. So if they ask me, I'd probably give the same answer that the city council people gave, and that's attract the revenue to Elgin. The accessibility is everywhere. Kids can get cannabis easier than they can get alcohol, and it's on the black market. The people that are going to get it legally and pay the taxes and help fund some of the projects they're trying to fund, I think I kind of understand where they're coming from. And then we get in the, a completely different argument is, is it moral for us to decide what somebody puts into their own body? And I'm getting all this from the email that came out in opinions. I think I replied to all on it. I might have just replied to Gil. I can't remember. But our job as a coalition is not going to get any easier. The stuff that they've passed recently for law enforcement in Illinois is tying the law enforcement officers' hands a lot, which is going to make our job a lot more difficult in a coalition. People are literally going to be in and out of jail because there's going to be no cash. You don't have to post bond. And, that's probably good in a lot of reasons, and it's also bad in others. So it's going to be a rotating door. They're getting away from jailing people for, nonviolent crimes. All these things will make our job as a coalition and the Elgin Drug Unit a lot harder to do. And we should really pay attention to elections and vote how we, what makes sense to us as far as the laws that are being passed. That's basically what I can say. There's no crazy amount of trends, except I think that, drug use has gone up because of the pandemic. Proactive policing has gone down. There's probably a correlation there. And we're back at it and doing our job. So I'm happy about that. I'm open to any questions too, if people have them. All righty.
Oh, I guess I do have a question because from my perspective, as obviously we deal with youth, like a dispensary that has cannabis in it, I'm very naive, so I'll be the first to let you know that. Like people can buy like a brownie, or they can buy like a gummy, but it's supposed to be like minimal cannabis in it or something, but like people could still overdose on it, right? Like if a child got a bag full of their mom's brownies that she bought legally, it still could harm them, right?
So I would refer you to a doctor on that. It would be way easier for a child to overdose. And I don't know of any deaths or permanent damage that have come by an amount of cannabis. Maybe people taking cannabis and then making a bad decision, or it affecting, their equilibrium or judgment or something like that. It's not as easy. Like, it's very simple to overdose from Advil, Tylenol, aspirin. Any of these drugs will kill you, where cannabis, it's not dangerous to overdose on, other than something that might happen to you after it. Nicotine and caffeine are probably more dangerous. Okay. So could they ingest it? Yes. Could they feel the effects of cannabis? Yes. Are they likely to die from it? I've never heard. I would refer you to, I could be the source of a source and say, research it yourself. But yes, this isn't a drug that, like heroin, that you're going to die if you overdose from. It's not a drug even like aspirin, Tylenol, Advil, caffeine, nicotine, as far as the dangers involved and how easy it is to get access to enough of it to hurt yourself. But it is a drug. It's only for people 21 and over. It's not for law enforcement. Employers can prevent you, not to give you like jail time or something like that, but if you're on call, they can have a say in whether you're allowed to do it or not. And, as far as, is it a good idea? Is it a gateway drug? These are conversations we have in coalitions. But yeah, it's not the same danger level as over-the-counter drugs.
Okay, that's good. I mean, and I don't know if like that's some of our, maybe at some point we'll have one of you come and speak to our middle high schoolers to understand the difference. And I think that's even knowledgeable. Like this is for someone who's 21 and older, and that's good information. So thank you.
Yep.
If a kid does get a hold of like a whole pack of gummies or something, they probably will still end up in the hospital for overdosing, but it's not necessarily going to, like Bernie was saying, it's not going to kill them, but they're definitely going to be feeling those effects, and they're not going to know what to do with it at that point.
They'll be, so, you know, I hear like, and I'm not a medical doctor, right? But from my street knowledge, you'll hear people OGing or overgreen or something like that, and they get sick and they hallucinate, and they sometimes claim that they're dead or they're dying. And, you know, they go to the hospital and, you know, get put under observation and stuff like that. But like I said, the actual amount to kill yourself is, you know, maybe somewhere near your body weight or something crazy like that. It's like, you know, you're going to wish you didn't if you take too much. But the other thing in the Illinois law is they can't market it to kids. And it goes back to like, you know, Camel cigarettes using like a cartoon camel. If it looks appealing to children, they're not allowed to market it that way. The police department is not responsible for enforcing whether they do or not, but they have to have on there how much, you know, what percentage it is. There's limits to weight. There's limits to, you know, amount of doses in that. You think gummy bears, to me, sounds like they're marketing it to kids because it is resembling candy. So, you know, maybe they, you know, I don't know how they're enforcing that kind of stuff, but that's stuff that's all in the law. I don't like the law. I wouldn't support it, but it is what we have to deal with. And we have to also speak to misinformation, you know, of, you know, well, could a kid get a hold of it? Yes, it wouldn't be as dangerous if they got a hold of a bottle of Tylenol.
Thank you, Bernie. Appreciate
Yep.
it. Any other questions from anybody?
I have a question for Bernie. You said that proactive policing is more difficult now. Can you elaborate a little bit about that? How is it different now?
I think that mostly, you know, if you look at some of these laws that are come into effect, and I'm not a lawyer, but there's things that say that we can't, you know, use force to make arrests if we can otherwise make an arrest at a different time. So police officers are going to ask to make split-second decisions on, am I going to be able to arrest this person at a later date? And they're taking away a lot of our protections if we were to make a mistake, even be an honest mistake that has never been ruled on. We can be sued civilly. And so where is proactive policing going to be hurt? You know, if we stop someone and they choose not to stop, and we say we have to make a decision, can they be arrested at a later date? Is it worth chasing them? You know, a lot of decisions like that are going to be asked for police officers to make. And is it worth being sued? When we write police reports, we refer to our body camera, right? Because like the incident just happened, you have a recollection, and then you watch your body camera and write your police report. They've said that we can no longer look at our body camera to write our police report. And if they don't match, we can be charged criminally. So what are police officers going to do? I can tell you like thoughts that have been discussed, you know, and you've seen chiefs of police speak out against the law and the way it's written. Hopefully there's trailer bills. We're not hopeful that it's going to happen, but I can give you an example of, is it fair to write? And these are things that are, you know, we're looking at for our legal department and, you know, the police officers unions. Can we listen to our body camera? Can we just write a report that says refer to our body camera? Can we have software or hire a bunch of people to transcribe our body cameras and then use that as a police report? The latest I got from a company that the city uses for our training is, you know, there's a lot of things that can be done, and it doesn't make a lot of sense why you wouldn't let a police officer look at his body camera before writing a police report. It seems to be, to us, a trap that's being laid. And when you lay a trap for police officers, you're going to get police officers that don't want to take a chance, even, you know, for the right reason. They're going to say, well, if I stop this car, make an arrest, I have to write a police report. I can't look at my body camera. You know, is it smarter just to go to the calls that I have to go to? And these are decisions that everybody's going to have to make every time they see something. Mm-hmm. And I think that you're already seeing a dip. And if you look at, you know, trends across the country, you're seeing an increase in crime because of it.
Yeah, I see that in my own neighborhood. So, but I want to thank you for the job that you guys have done so far, because I think the Elgin Police Department, and everywhere that I've lived, is the best police department that I've come in contact with. And you guys are very quick and try to help. So just thanks for that. And it's just, it makes me sad that your job is getting just that much harder.
So if you know, I was just actually in a meeting, and I don't have to put all my personal business out there, but my kids' performance in school. So I live in McHenry County, and I don't remember the numbers for Kane exactly, but they were discussed in our CSHE group as far as like truancy. In our CSHE group, I believe there was 2 truancy officers in McHenry County or Kane County. Didn't come from me. But, you know, if you look at the thousands of truancy cases across the district, U46 is the second largest district in the state, next to Chicago School District. Chicago CPA, I think, Chicago Public, whatever it is.
CPS, yeah.
CPS. Okay, so we're number 2. And, you know, the whole county's got 2 truancy officers, and it was either like 1,200 or 1,400 truancy cases that 2 people are supposed to investigate. So along with all these changes in laws, they've offered no funding, demanded that we're better trained, and offered no funding for the training, no funding for the state's attorney. You know, there was one, I think it was DuPage County came out and said it was going to cost them $6.5 million because of these changes, and they didn't offer 1 penny. That's one county. They didn't offer 1 penny of you know, support for this law. Well, you have in Elgin, you have Cook County, you have Kane County, and then this is just affecting Elgin. There's no funding for it. So what's going to happen? I don't know. I can tell you I'm nervous. The stat that I heard was 65% of law enforcement officers in Illinois are looking for different jobs or exploring the option of leaving. I'm one of them. Almost every one of my friends here is one of them too. I think that number, I mean, maybe there's 35% of people that are brand new into it, excited, or people that they're kind of halfway and stuck. But I think that you're a fool for getting into law enforcement at this point in Illinois. And I am one of the 65% who is exploring leaving.
Wow. You're bringing me down.
Yeah, no.
I want to leave you, but I can't. So
here's the thing. I'm well paid. I've loved my, you know, position. I love my police department. If there's somebody that's doing the most, our chief of police spoke, testified to the Illinois lawmakers, the issues with this bill. They passed it anyway in the middle of the day. And I don't know who's calling me. They passed it over in the middle of the night, and then the governor signed off on it without making the corrections. Most people believe there needs to be some type of law enforcement. What's the word I'm looking for?
Reform,
yeah. There needs to be some type of reform. But what the governor said on TV is people that oppose it are 100% opposed to it and don't want to make any, you know, recommendations. We don't have to, by state law, have body cameras in Elgin, but we do. And it's because our chief, when she was a commander, got the funding to get them.
And I remember when she really spearheaded that project, which I think was a great idea. Bernie, we're kind of running out of time.
Okay.
If you want to wrap up your thoughts just real quickly, then we can move on to the social media report. Thank you.
Sure. My wrapping it up is pay attention to elections, including local elections. Watch what they're saying. If they support blanket things without listening to input, I would, that you're going to get what you're getting right now, right? And we're all responsible unless we've researched every person and voted in every election, which I haven't. So I'll just let you guys know that.
Thank you, Bernie. I appreciate that. Yeah, definitely sage words to be sure. And just my comments. I mean, unfunded mandates happen way too often across this country, leaving basically a trail of bodies. And so I hope that maybe in the soon future we can turn that 65% number around, because I think you guys are doing great work here in Elgin, and we'd love to keep you. Right now with social media, Jared, you on?
Yes, thank you. So again, our goal is to try to engage our community, engage our youth, try to create things to help them be aware of who we are, right? Because after the 5 years, we're going to be on our own and we can't just rely on other people and things like that. So we've had this social media plan, and within that plan, I just kind of wanted to share with you guys just kind of briefly over the past month. This is over Facebook. We've had a 222% increase in people reached. Okay, so on posts, on things we're sharing, things like that. On post engagement, so replying back for people replying, because I know that's what we really want, right? When we post something, we want people to reply back, whether it is good or bad, right? I mean, it's not everything's going to be perfect, so we want to, have both ways, and that's increased by 30% since February 9th, so a month ago. And our page likes / followers, we have gotten 23 new ones in the past month as well, so that's been a 630 increase. So again, things are slowly progressing, which is very good. Obviously, there's way more room for improvement. I just actually, one of our action items, it's with Sophia, who's not here, was how do we engage social media appropriately, right? So we're always thinking of different ways to do it, different ways to engage youth, different ways to engage parents, different ways to engage just community of Elgin as a whole. So if you guys have anything, or, just think of anything, always just let me know. I'm always looking for suggestions. We also had a action item meeting yesterday, which went very well, right? How to disseminate flyers appropriately to the community, right? People want to see things and know about it, but they don't want to read a book, right? They just want to get a few words here, a few words there, know what we're about, and kind of move on. So again, it's going well, but there's always room for improvement. So again, if you guys have any ideas or thoughts, just throw them my way and I will talk to you. Thank you.
Thank you, Jared. I appreciate it. The next item is open floor. Lorena shared a little bit. Does anybody else have any events or activities or any information they'd like to share with the rest of the group that maybe is happening in their respective agency or organization? If not, our next item is the Kahoot on prevention knowledge. Is one of our action items, is to kind of gauge everybody's level of prevention knowledge, so we kind of know what we're going to do. So we're going to yeah.
Oh, sorry. I just wanted to share that one thing I forgot to mention earlier, we actually have a peer recovery support specialist joined our team recently, and he's going to be a part of the medication assisted treatment team. So he's going to be working one-on-one with individuals who just need support in their recovery, as well as he's going to be doing groups. I will be able to provide more information on the groups at a later date. I think we're kind of figuring it out with the pandemic and everything going on. But I don't have a flyer yet. But once I do, I'm going to be sharing that with you all. But I just wanted to let you know we do have someone who's going to be working alongside them. Anybody who's interested in working with Mark, I'm sorry, is able to, as long as they are patients, so they could be a patient of like primary care, behavioral health, or any of our specialties, and they're able to have access to him. So, but more information to come.
Oh, that's great news. Thank you, Lorraine. I appreciate that.
Mm-hmm.
Yeah, let us know how we can help and support that effort. The more Matts around, the better. So thank you.
Yeah, definitely.
Jessica, you're on.
I think there were a couple more people that wanted to say something.
Oh, I'm sorry. Who's next?
Okay, I was just going to mention that we did get the go-ahead for putting a detox. So we're working on detox residential additions, and we are McHenry County, so in Crystal Lake, but still like a ways out, but we have the building space and past parts of the zoning stuff. So just I'll keep you guys updated on that, but that'll create a bunch more beds for detox and residential drug and alcohol treatment.
That's great. Thank you, Jenny. And you got a new executive director as well. I saw something in the paper. Nick, forgot what his last name was.
Yes, Nick Howell. Wow, that already went out.
Yeah, it's I read it yesterday. So congratulations on that. I hope that really turns out to be a good thing for you guys. So that's awesome. Glad to have Northern Illinois Recovery on board. Thank you.
Sure.
Who else? Okay.
I mean, we're doing our communication campaign. So if you want materials, we got materials.
Yes. You know, we want to share those. And in case anybody is not sure what that means, what does that mean, communication campaign?
So we're doing one for alcohol and one for the vaping hasn't kicked off yet. But putting out materials with information, statistics, everything for communities. We're distributing them to the schools, sharing on social media. And then we have, when we can eventually have in-person materials, we have like folders and stickers and everything to pass out to as well. So
great. Awesome. Thank you, Jessica.
And just
so when you have that, will you send those flyers via email? Because I can easily send them to our staff.
Sure.
And we work with K through 12. We have some contact with our teens, it's slow. We have they're getting in contact with some of them. So yeah, yes. That would be great.
I can do that.
Awesome.
And just real quick, I did put the survey or at the link here, just so you guys can take that before you guys leave. I know you have to do it this second, but just want to let you guys know I left the evaluation on the chat.
Jenny, I got you. When we get them up and going, I'll give them to you.
You're on, just.
Okay. Let me share my screen. We're going to play a Kahoot. So you can either do this by going, it'll show you on the screen. Wait, is this the right one? No. Okay, try that one. Does that work? Well, sorry, I was using Google Meets earlier today and now I'm all confused on Zoom and it's all good. Okay, so you can go to either open up a new tab browser and you can go to www.kahoot.it. You can do that on your phone. You can do that on your computer. You can do that if you have the Kahoot app. You can do that as well. You will need to be able to still see my screen, so you can do like 2 tabs on the computer and go back and forth or you can use your phone. Usually your phone's just easier. But whatever. And my shoulder's kinked today. Cool beans.
I can't figure this out. Can you tell me one more time?
Yeah. So if you go to kahoot.it, the website.
Okay, so I got to go out of here. That's what.
Are you on your phone for everything, or are you by a computer?
Oh yeah. So I'm by my computer. I can
go to your
a different-
computer and go to kahoot.it. And then you can just see on your screen, you'll see the questions come up on your phone, but then you'll answer on the computer.
What's the game pin?
Yep, 957-7600. Can y'all hear the lovely music in the background or no?
No, see how
Okay,
lovely it is.
I'm muting it because I've been listening to it all day.
Oh.
And it's like, do. Oh boy. Okay. I think that's most of you guys. And if you want to join, you can always join in afterwards, or you can just type in the chat box or whatever. So there's right or wrong answers, but it's not, yeah. So CSU's mission is to promote a safe and healthy community free of violence and substance use through Gill's grand gimmicks, education, prevention, action, executive actions, or investing in the community. Gil, did you update the mission statement since I made this?
We just added youth.
Okay. I realized it as I was reading it. I was like, oh crap. Yes, it's not Gill's grand gimmicks, but it would be very entertaining if it was. Education, prevention, and action. And again, this is not like I mean, it gives you points, but we're not scoring you guys. It's just to kind of get a check-in of what the knowledge is. Number 2, which answer is not part of the definition of prevention? Oh, I forgot how long these were. Proactive process that empowers individuals and systems, meets the challenges of life events and transitions for specific individuals on an unneeded basis, or creates and reinforces conditions that promote healthy behaviors. Sorry, that one was really long. I forgot to change the time, I think. My bad. What is or are the main goals of DFC-funded community coalitions? Establish and strengthen collaborations with community organizations, reduce substance use among youth, provide alternative activities, or A and B? Good job. Usually if there's an A and B answer, that's the answer. Okay. Scare tactics, also called fear appeals, have been proven to be an effective prevention strategy. True or false? They are effective. I can talk. False. They are not good. And what level of change is the coalition mainly targeting? Environmental, small group, direct service, or educational change? So I hope you enjoy all the pictures of the random animals that I found for this one.
We are.
It is environmental. I know educational is similar, but technically it's environmental. Number 6, how many sectors of the community are required for DFC coalitions? 7, 10, 12, or 15? Twelve is correct. And Gail has a whole acronym he could tell you at some point if you're curious. I won't ask him now.
Yes, thank you.
And this is just, there's no right or wrong answer. My comfort level with the strategic prevention framework, which is this lovely little flower. Are you very familiar, somewhat familiar, not very, or you have no idea what this flower and letters mean? Awesome. Yay, we see an increase. I think that's an increase from last time, that more people are somewhat familiar. And if you don't know, Gil will tell you all about it at some point. All right, I'm going to stop sharing because those points don't win. And I'm done.
Thank you, Jessica. Are you done? Okay, thank you. I appreciate that. And you will be sharing these results with everybody in the next month, hopefully. And if you're not completely familiar with the strategic prevention framework, our latest podcast that we just published is entirely devoted to that topic. So if you haven't subscribed to our podcast, please do so. All right, thanks. I think that's kind of it that we had. Again, this is really important for us to kind of gauge where everybody's knowledge is on prevention, because some of us are very advanced and some of us are just kind of started. And so we want to make sure we tailor our approach and our resources to however we can do to help you. Jared's already put in the link for the evaluation. So we're done with the meeting unless anybody has any last minute open floor items or any last minute comments that they want to make. The evaluations are important. Please make sure that you click on that link in the chat and take that. It doesn't take long, but the results and the information that we get are really valuable to us. Anything that anybody have for good of the order before we leave? All right. Thank you, everyone. I really do appreciate you coming. Our fearless leader is in Baltimore. So obviously he had issues getting online. Maybe it was the whole hour change, who knows what it was. But trust me, he was prepared and ready to go today. Just obviously something happened. So anyway, everybody take care. Have a fantastic rest of the week. And please let us know if there's anything we can do at all for you or in your job or your organization. Thanks so much, everybody.
Thank you. Bye. Have a good day, everyone.
Goodbye, Lorena.
Gil, did you do the Kahoot twice as Gil and Gil 2?
Yeah, I exited Gil and then I couldn't get back in. It says somebody's already got Gil. So
got it. Okay. I was like, because like only one of them was answering. And I was like,
yeah, sorry. Yeah. It just wouldn't let me back in.
It's okay. I'll send over the report to you. Okay, bye.